Infertility rates are rising, according to the CDC. In the U.S., 1 in 5 women are unable to get pregnant after 1 year of trying, and 1 in 4 struggle to carry a pregnancy to term. Dr. Christina Captain is the lead practitioner at the Sarasota Center for Acupuncture and Nutrition. She's here to talk about help for couples with infertility struggles. It's good to see you.
Good to be back.
This is one of those topics, certainly one I went through a little bit in my younger years, but also that you're like, oh, getting pregnant, it's easy, except when it's not. And it gets so emotional and so hard. And I was surprised to see these statistics that rates are rising. Yeah. What do we think has to do with some of that?
Oh my goodness, so many things are happening, both on the male and female side. The biggest one for females is stress. And endocrine disruptors. So endocrine disruptors are things that mess with hormones, that create an imbalance in hormones. Stress is one of the #1. Chemicals are other ones. Toxic chemicals, foods, pesticides in foods. So if you're eating conventional foods, all these things can affect how you can get pregnant or not. And for men, we see that there are these estrogen, we call them xenoestrogens in the environment, and they affect men differently. In fact, where they're losing their ability to create as much testosterone, sperm, their way that they're motile, how they can really swim up and meet that egg, the way they're structured, their form, all of that changes now with those exposures to xenoestrogens.
So when someone comes to you and has fertility and infertility concerns, it sounds like you start with a lifestyle approach. You kind of delve into, I would assume, both, partners and how things are going, what they're eating, where do we start with a couple?
So, it's really interesting. If you think about it, most people feel like it's always the woman's fault. You need to figure out something's going on with you, right? Men, we have to be able to test what's happening with the sperm. Are there enough? Because sometimes low counts are a big deal. Low testosterone's a big deal. Are they formed right? Morphological changes, which is the structure of the sperm. That has to be important. So both partners are always important. The female, of course, we're always going to have issues with hormones and possibly gynecological things like fibroids or cysts or PCOS, polycystic ovarian syndrome. Well, when you come to our center, we definitely want both parents there. We want both future parents there, and maybe they've had a baby already, but now they can't conceive again. So when both parents there, we want to be able to see some blood work. We want to be able to check hormone levels. If it's a male issue, we want to make sure that everything's good in that department. Maybe they've already done IUI and IVF, and now they're looking for, we can't go through that again. Or they're maybe just going to start IUI and IVF, which is reproductive endocrinology, where you go in and get help. And they're like, we need help, we want to prepare, or we don't want to do that again. We do everything for you if you want. We can act as a solo, looking at blood work, making sure both partners are good, and then preparing for that intentional conception. The idea in traditional Chinese medicine is that you are actually looking to create life. It's not just, well, I'm ovulating, let's do it. Right. It's about, how do I prepare my mind, body, and soul to create life? And so we need to make sure we detoxify. We make sure we're not eating a bunch of sugar and chemical-laden foods. We want to make sure we're exercising. We want to make sure that we are meditating and breathing and spending time in nature, eating proper food, drinking proper water, getting proper sleep.
Right.
And then acupuncture, baby. Whether it is on a solo, where we're the only people in there helping and we're working with you with acupuncture. Baby mama comes in for about 2 cycles, making sure we're making it very welcoming for that embryo. Baby daddy comes in right before we're ready to try, right? So he comes in, we have him on some supplements as well. He comes in, we start to give him some energy tonification with acupuncture, and then we try, intentionally try.
Right.
And then the point is not to just get pregnant. The point is you end up with that healthy baby in your arms at the end. So we take you from getting you ready to getting pregnant to maintaining through that first trimester, and then we're bye-bye for a little bit unless you need us, and then we can help you induce labor.
So this continues through the first trimester. That's interesting information, because that's obviously when the majority of miscarriages occur.
Absolutely.
So there are things that you can do through Chinese medicine to help keep that environment healthy for a developing embryo?
Through acupuncture, through nutrients. So lots of times that miscarriage in the first trimester happens because of a genetic SNP, a single nucleotide polymorphism, the MTHFR, right? So we know that we want to make sure that patient is on the right supplements to counteract that, or any of the other SNPs. There's a million of them, right? We all have. We all have SNPs. So yeah, we take everybody through. And if it's a person who's going to be doing IVF, statistics show that a successful implantation is 80+% more successful with acupuncture prior to and after the transplant.
Wow, that's an awesome statistic, especially when you look at the amount of money that it costs to have these, other procedures. So to be able to support it, with someone else. And, I mean, from my own experience many, many years ago, it was really stressful. So when you know that you're supposed to be unstressed to, ovulate, conceive, and then implant, it's a lot easier said than done. So it's nice that acupuncture works in that way.
Exactly, because all of that stress comes down, that 2 cycles that we have, we really want those 2 cycles first. That's about reducing that stress. But because look at what women are doing nowadays. I mean, we are working, we are juggling, we're going crazy, we can't get anything done. If you don't have time to make an appointment to talk about becoming a mom, you probably don't have time to be a mom right now.
Right, and your body's probably not going to be ready for it. So, all right, a wonderful supplement or simple solution, perhaps, to many, many infertility issues. For more information about Dr. Captain and her team and how to get help with infertility, you can go to scansrq.com. We'll be right back.